Thank you for joining us today on the Health Show. Welcome here. Today we're going to have an interesting discussion with Doris Murimi, where we're going to talk about endometriosis. My name is Dr. Ruguru Kimani, here to expound and learn more about endometriosis and mental health. If you'd like to join us on social media, you can do so. On Facebook, you can join us on Switch TV Kenya, Twitter, Switch TV Kenya, and Instagram, Switch TV KE, right here on Switch Media. So Doris, please introduce yourself and tell us more about what you do.
Thank you so much for having me on the show. Yeah, so I'm a menstrual health, adolescent menstrual health advocate, and I'm the founder of Endo Sisters East Africa Foundation, and also an author. And in another life, I'm a governance and HR practitioner. Okay. Yeah, but this is my passion. This is where I concentrate most of my energies and time.
Okay, so tell us, what organization do you run with?
Yeah, so the foundation is known as Endo Sisters East Africa Foundation. Okay. Yeah, and really our focus is two-pronged. One, it's to disseminate information on menstrual disorders. So menstrual disorders is just basically abnormal menstruation. You know, the situations when the menstruation doesn't go as it's supposed to be. So we feel that especially in the Kenyan education system, people are not aware about what is abnormal menstruation or what is menstrual disorders. And that's where you find conditions such as endometriosis, you know, you find people having even amenorrhea, women without periods, you know, those kind of premenstrual syndrome, dysmenorrhea, of course, you know, and other conditions, adenomyosis that cause a lot of pain, endometriosis, of course, fibroids, and, you know, all these kind of situations. Yeah, so we work on disseminating that kind of information. In fact, that's why we have our book out on understanding menstrual disorders. So that's one aspect of our work, and as a result of this, we are part of the Ministry of Health working group that's in helping to implement the menstrual health policy in Kenya. Yeah.
Oh, that's good. You're a huge change maker in a society. You're doing a very good job. Yeah. So tell us, what is endometriosis?
Okay, before I get to endometriosis, the second aspect that we do also of the foundation is now seek social justice for women and girls who are living with endometriosis. Yeah, so that's also, you know, because we had to put that first part of it, and then so that people can understand it, and then now we seek social justice. So talking about what endometriosis is, it's basically when the lining similar to that found in the uterus or the endometrium is found outside the uterus, and it can be found out, out in the pelvic region, you know, like in the ovaries, in the, perineal cavity, you know, it can be found even in the rectum, it can be found, you know, in different aspects of, even in the, towards the bladder, in different places of the pelvic region, but it also moves up. You know, there are women who also have, who have it even in the chest, you know, in the lung, for example. We've heard of women having it in the eyes and all that. So basically, endometriosis is considered a whole body disease because it has an effect on practically everything. So we cannot just say that it's just found within the reproductive organs.
Okay, pretty insightful. Okay, so tell us, what are the causes?
Yeah, now the causes are, until today, you won't believe it, I don't know how many years later, are still unknown. Nobody knows what causes endometriosis. I mean, there have been theories out there. There's the famous one, I think, retrograde menstruation. Yes, there is that. There is also the issue about the scar tissue that forms. You know, if you have an operation like a C-section, and then that scar tissue that's formed will cause endometriosis. There is about being born with it. So those have been, you know, various theories, but to say the truth, nobody actually knows why women get endometriosis. I think the biggest, maybe the closest thing is that they do suspect it's genetic in nature, that, you know, that people, maybe you will find it in your line, in your family line, that somebody within your family, either your mom, your grandma, or somebody had endometriosis. Yeah, but until today, it's really, they've not known what the cause is. In terms of symptoms, it's usually, it's seen, I think the issue of menstruation is one of the easiest ways or the first ways of identifying that somebody may have endometriosis, because most of the time, and here I qualify and say most of the time, because it doesn't happen for all women. Most of the time, women will experience, and girls will experience painful menstruation, heavy menstruation, pelvic discomfort, bloated, bellies, and feel, some of them will have headache, others will have leg pain, and those kind of symptoms. There are other girls or women who will experience absolutely no pain at all. So it's a very individualistic disease. So it's very hard to kind of peg it, because somebody could have endometriosis and even a higher stage of endometriosis and still experience no symptoms, simply because of where it is. Where it could be in the body. Okay,
so clearly it's hard to tell whether you have endometriosis or not. Symptoms are broad. So it requires a high index of suspicion. And seeking medical help early.
And also the one sure way of determining that someone has endometriosis is through laparoscopic surgery. That must be done, laparoscopic surgery. And then they also talk about the gold standard of treatment again has been known as excision surgery. Excision, where they cut out.
In another life, you'd have actually been a doctor.
We have had to learn these terms, I tell you.
You're doing very, very well. I'm very impressed.
Thank you.
Okay, so tell us, in regards to mental health, what kind of stressors or, mental health disorders have you seen with women who are suffering from endometriosis?
I have, this is a wonderful discussion, first of all, because when I think of my own example, I started my periods when I was 13 years old, and from the moment I had very painful periods, so already psychologically I was already knowing that I'm different from the other girls, because the other girls, it was okay for them to just have their period for the 3 days, and then and they had no discomforts or anything. But for me, it was physically painful, and that caused me, even because mine were very heavy, they lasted long, about 5-6 days in school, very heavy, and I felt like and very painful. So for me, I started social withdrawal, even from my friends, because I started feeling embarrassed that I'm not being able to withstand pain like the other girls. So it starts, so that's actually where it starts for a lot of the girls and a lot of the women. They have social withdrawal. They have many of them get panic attacks. Many of them, actually, it starts with anxiety, high levels of anxiety. Why? Because you're always wondering, have I stained my dress? Have I done that? Will I miss my exam tomorrow? Will I make it to work today? Will I do this? Will I be able to meet up with my friends? So that causes very high levels of anxiety, and then nobody really understands you. Self-esteem goes down, self-confidence is low, because no one understands. You feel like you're weaker than the rest because you can't withstand pain, And at that time, every doctor you saw said, "Oh, there's nothing wrong. It's okay. It's just periods," and nobody talks about the underlying problem.
So, and what about facing stigma? At work or with friends, they feel like you're always meeting out, from work, you can't hang out because you're always having painful cramps. What can you say about that?
Actually, the stigma is even what propagates. It propagates this, it's like a rolling ball, that just snowball that keeps growing bigger and bigger, because there's nothing, you have nothing to do within your power, to stop it. And it's not just at work, even with your social, even within the family. Everybody now notices that you're not available to do this, or sometimes you have to stay in bed because of the pain and all that. So of course you're conscious of your shortcomings, and in your mind, because you're not discussing it with anybody, they become so magnified, and that's a real stressor. And then another thing that happens is some of the medication that the women or the girls are on also cause depression. So, you can get depressed just because of that situation. I mean, being in, that kind of situation will cause you to be depressed. But also the medication also accentuates and makes people even feel depressed. And it's really, really bad. Without treatment, I mean, many women feel suicidal. Many women are in a dark place, and they become unproductive. They cannot work. It becomes very difficult to be in an office. They reached a stage, even in my own personal life, where I had to stop working because I couldn't handle it anymore. I just stopped working, and it was so difficult.
So let me ask, with the organization,
Yes.
do you have any mental health plans or activities that you do to help women who have endometriosis?
Yes, in fact, that's one of the things that we really concentrate on for the women members. So one of the things that we have, first of all, is an online support group. So the support group is a group where we share our fears, we discuss what we are going through mentally, and it's a very safe space to discuss even our darkest thoughts and what in the kind of trauma that we are experiencing. So it's a good space. So that's one of the things that we do. Yeah. The other thing is we've held therapy sessions where we've gotten counselors. Okay. We've used like Fountain of Wellness counselors, we've used individual counselors to come and speak to women, to the groups now during our meetings, and just talk about therapy and the benefits of therapy. Talk to us about what we are going through, the mental, what it's doing to our mental health, and even take us now for discounted mental health sessions. Yes, okay. Yeah. The other thing that we've also done is because it's not, you can't do this in isolation. Remember, we have partners, we have family members, and there's a society at large. So I think last year we had a good webinar where we talked about reproductive health issues. Well, of course, focusing on endometriosis. You know, sometimes when you say endometriosis, people are like, what is that? So you have to link it to, to something. And family support. And we talked to families about how do you support your wife? How do you support your daughter? How do you support your friend who is going through living with endometriosis? How do you support us, psychologically, emotionally, and all that? Yeah. Okay. So those are some of the initiatives that we've done.
You're doing a great job. And at this juncture, I would like to take a break. Please join us after the break and learn more about endometriosis. Thank you for joining us again right after the break. Our show is State of Mind. And if you want to join us on social media, join us on Facebook on Switch TV Kenya, Twitter, Switch TV Kenya, and Instagram, Switch TV KE. So we still have our lovely guest here, Doris Murimi. So Doris, tell us, now, in regard to mental health, what mental health disorders specifically have you seen to be propagated by endometriosis? Is it depression? What have you seen mainly coming up from this?
I've seen depression. I've seen anxiety, especially anxiety disorder. I've seen post-traumatic stress syndrome, where because many women never got help when they should have. Yes. So you see the trauma is there. Yeah. And panic attacks, suicidal thought, and social withdrawal. Yes. Yeah, those are some of the things that we have seen.
The things that you've actually said.
Yes.
And actually, in regards to the pain being a lot, people can even get fired because they're not able to work, they're not able to function socially. And having had stories from friends who've also suffered from the same, I can actually agree with you that mental health becomes a very big problem. So for the young girls who are 12 years old, have you been able to reach them in school, or are you waiting for them to get to 30 years when they can afford to have a phone and see your discussions online? How are you reaching those?
Okay, that's a great question. Actually, it's the reason why we wrote this book. Okay. This book actually has just finally been approved by KICD as a school-approved textbook. So it shall be available in schools. Okay. Yeah, so that within the CBC system, so that at least girls and boys also are able to have access to it. We've also been lobbying the Ministry of Education and of course working with KICD to introduce this as a topic under the whole issue of menstrual health and hygiene, because that is there. I think the talks have been there even with the Ministry of Health for that topic under the policy to be introduced, but they didn't have the component of menstrual disorders. Yes, so we've been pushing for that topic to also be included with them. Yeah.
Okay, that's brilliant, because I had endometriosis for the first time in medical school. So having this being learned right there,
yes,
from primary school is going to change our society. It's also going to change how we're looking at things. So what are you doing about the boys? Because at times we have girls who don't have partners.
Yes.
And they have just a male male gender around them.
Yes.
So are you also teaching the boys? Are you also involving the men
Yes.
in this discussion?
Yes. In fact, this education will be in schools, will be there for both boys and girls. Actually, even when we go for our outreach programs, we always do so, because we do quite a bit with campuses and also schools, high schools. We have them with both males and females, because it's very important for men to be able to understand. Even when we talk to the support, the extended family support, it's both, it's parents, it's guardians, it's even, there are people who just have a male guardian. So it's very important that we have done that. The other major thing our organization has done is we've just completed our research on endometriosis in Kenya. We did a research study with together with Columbia University in the US and Kenyatta National Hospital, and as well as another Institute of Primate Research. And that research will be available in one of the medical journals, and it's privy to everybody, so that people will be able to understand that this actually goes on in Kenya even as well.
Okay, that's good. I like that you're bringing in the educational aspect of it, and also putting out documentation for people to look at and read and see for themselves what is happening. So now the question is, now, how are you discussing the medical diagnosis or medical management? What do you talk about? You talked about pain medication. So what do you think about using pain medication for very painful men? What is your thoughts around it?
Now, these days, at least, we are very fortunate that we have pain management specialists. So in our discussions, even within the support group, we encourage our women to see the pain management specialists, because it's very easy to overdose. It's very, very, very easy. I've been there, and you overdose because you're taking, the pain is not stopping. And there's also a crutch in your mind, because you even anticipate the pain. So now, in terms of, so there's a pain management specialist, that's been an option. The other thing is, through the therapist, we've been able to realize that some people require more than just therapy. You may need to see a psychiatrist, because psychiatrists are the ones who now can give you medication. Like for anxiety disorder, you must be given some medication, prescribed medication. And I have also interacted with some of them, and like I was speaking to one of the psychiatrists, leading psychiatrists here in Kenya, and she was saying to me, Doris, endometriosis patients are one of the most difficult to treat, because the trauma is ongoing. It's not like it's leaving them, and it's difficult to treat them, but they need some of them, especially with anxiety, you will need to be on that medication. And for some people, that medication causes them to feel very depressed, so they don't want to be on that medication. And so for others, it's okay. They need to see maybe sometimes a psychiatrist, and also be in constant therapy.
That's true.
Which is expensive.
It is actually expensive. it's very expensive. And actually, I remember a story I shared with you earlier before you started about as someone I know who tells people that they're having problems with their stomach, they're having loose stools, they're having vomiting, because they don't want to mention that they're having problems with their menses. It sounds embarrassing. You sound like you're weak. So do you have stories to share with us in regards to that, something that you've seen?
Actually, my own personal experience, my own, because I knew from a very young age, about 12, 13, that there was something wrong. My mother took me to 4 different gynecologists. All of them said the same thing, that you have, it's probably because she can't withstand pain. She has a low threshold of pain. Because they would check, that time they would check, there are no fibroids, that's all they used to check, and then they don't find that. And then they would also check for pelvic inflammatory disease, and then when they check for that and it's not there, then they just say that it's in her mind, it's just a low threshold for pain. So I was told that so many times. I even went, when I was in college, I even went to see yet another gynecologist. And I remember during an exam, just, the pap smear exam, I was in so much pain. I really screamed. And she, with a lot of disdain, because it was a woman, looked at me and said, how do you expect to give birth if you can't even handle a simple period and a simple, just a simple examination, So that traumatized me and made me feel that to actually accept, tell people that it's menstruation related, is causing stigma, for me, it's, and I became so embarrassed, and I became a professional liar. I talked about how I had terrible food poisoning. Everybody for the longest time knew I had some horrible food poisoning issue.
Inflammatory bowel disease.
Exactly. And the problem with that is that even when you go to see a doctor, even a good gynecologist or whoever who would actually have the knowledge to help you, you are giving the wrong information. You're saying, I was too embarrassed to say that, to say what my issue was. So you continue with that and continue perpetuating and delaying diagnosis because you've been, lying. So so I understand exactly where they're coming from. That's the stigma, people think about other social stigma, but the stigma even to the person is really, it's intense. It's a lot. Yeah. But talking about it, creating awareness will make people realize that, so someone else has gone through it. So I'm not the first one to lie. So now I can own my truth and actually see a good gynecologist and say what I'm going through.
Yeah, that's very good. Also for us, for the medical practitioners, I think hearing more of this will also give us a higher index of suspicion and also enable us to listen to patients more. And also not say that they're having low pain tolerance, but want to investigate more. And also mainly women. Any success stories that you've had from people who you met who are depressed, who are doing badly, got a diagnosis, opened up, and now they're going towards recovery?
Yes, I mean they've been some. I mean I can't really pinpoint and just say names and all that. I think twofold. One in the medical and then in the group. I must say that from the medical fraternity, it's very good to see that. I understand it's even being taught now in school, as you said. So we are having GPs being more, being more vigilant, being more conscious about it, and actually they're the first point of referral for girls. So that's tremendous, because we even when we were seeing specialists, we still were not getting help, like gynecologists. So at the first level, the GPs, that's been tremendous. Seeing that they're referring. In terms of girls, being in a support group, I really would encourage anybody, and even encourage doctors, the gynecologists, and even GPs, to also, if there's the suspicion or the notion of even of endometriosis, that you encourage them to join support group like ours, because when they join the support group, we are able to work with them and we share, and we have seen people on the verge of being suicidal, saying that I'm here, but I'm fed up with it. But having a turnaround, actually having hope, having life, feeling they belong, and wanting to, to better, to take their treatments, and, and having hope for the next day. So we have seen that. Those are the success stories. When we see the women who were so down, and then you see them turning around because maybe some medication is working for them, or even their frame of mind, because sometimes it can be physical. Some may work, but even your change in attitude, your frame of mind, your understanding that you have a mental issue, you're now on medication, or you're now doing therapy, we've seen a real turnaround.
We've seen good results.
We've seen that. So and it's a day-by-day thing. So I'm sorry for that.
It's okay.
It's a day-by-day thing. Those results are not like forever, you take it one day at a time. But you see that somebody is able to live one day at a time, because that's all.
Moving on.
They keep moving
on and they change. So let me ask, so what is your parting shot to women out there who are struggling with endometriosis, who may actually learn that they have endometriosis from this show here today? What is your parting shot? What would you like to tell them?
I'd like to tell them to please, as when you know that you have endometriosis, one, please look for a support group to be there, to join a support group, because you need to work with people. And if you've had it for long, because I suspect many of them have had it, lived with it for a very long time, probably starts when you're in high school, please try and seek therapy. Go and see a counselor. You sometimes think it's your personality to be anxious, to be the type A personality. But it's actually that you're in need of therapy. Because the problem is that even when you get into menopause many years later, like myself, you get into menopause, and then you find out that you're still suffering from post-traumatic stress. Syndrome. Exactly. So now when you're still suffering from that, you're still back into therapy. The endometriosis may have left you physically, but it's in your mind, you still need therapy. So I would tell them, please take mental health seriously. And we also, as usual, always urge the government to take it seriously.
Thank you so much, Doris, for joining us today on The State of Mind, and you there back at home for joining us and listening to this interesting and insightful discussion. Join us next time at the State of Mind, where I'm going to be having an interesting guest to have an interesting discussion, and also follow us on social media on Switch Media. So follow us on Facebook, Switch TV Kenya, Twitter, Switch TV Kenya, and Instagram, Switch TV KE. Till next.